So one thing we found is that as the office goes through communicating with patients, which could be anywhere from 2 to 3 months of communicating with as many patients as we can, almost like every day the office gets more confidence around this and reports back that the communications are actually going very well. I check in with our clients as they're in the messy middle to support them, to provide reinforcement training for the team, to deal with new frequently asked questions that they might have been receiving. And what they often tell me is that, Gary, it's going better than we thought. I'm surprised how many patients have been supportive of this move for us doing this. They understand. And that's been a common response that we've heard, is that, there are some people that are, not happy about this, and they will choose to go somewhere else. That is a point that I want to make. You will lose patients when you resign from the PPO plans. I wish I could tell you there's a way to do it and not lose any patients. However, I've never seen that happen, so I'm not going to tell you that. You're going to lose some. But if you have a relationship-driven practice where you're truly connected, you and your team members develop rapport and relationship with your patients, the likelihood that they're going to leave is a lot lower. You'll lose some, sure. But when you look at that list of patients after the fact, the ones that leave are the ones that really don't appreciate all the things you provide for them. These are patients that really think of dentistry as a commodity, where in their mind, a dental office is a dental office is a dental office. And of course, we know a lot better than that. And they simply are more interested in a transactional experience. I have a toothache. I want it to be covered by my insurance. I'm going to find an office that takes my insurance. However, the ones that stay are really the patients that truly value what it is that you do for them. They value you, they value the treatment, they value your approach to care. Maybe they value that you work hard to make every visit a positive experience. And they make a conscious decision to vote with their feet and stay with your practice. And that is one of the most cool outcomes that we see when we do a debrief with our clients after they've successfully resigned from all their plans. And we do a debrief, and every time, and I have to be careful using absolutes. It's dangerous to use absolutes, like always or never. But so far, as of the recording of this podcast, every time I've done a debrief with a client, they report back and say, Gary, I lost fewer patients than I thought. I thought I would lose a lot more, and it just didn't pan out that way. And I'm thrilled with the result. The only regret that I have is that I didn't do it sooner. So by way of encouragement, I want to have a very encouraging message to you that this is what we hear time in and time out. That doctor and team members are absolutely thrilled they made this decision, and it went smoother than they thought. Yes, there's a messy middle. However, that messy middle went a lot smoother than expected. So part of the purpose of this episode is to prepare you for the fact that you're going to hit a messy middle. Some of you will know that I'm an endurance athlete. I run marathons, half marathons, and do triathlons. And in my long distance races, you're likely to hit a wall. They call it the wall if you're a long distance runner. And the wall will happen usually 2/3 into the race, maybe 70% into the race. And you hit that wall. And that's the messy middle of long distance running. You hit that wall. But of course, if you've done your training, if you've done your preparation, if you're prepared, if you're emotionally prepared for the fact that that wall is coming, you're much more likely to punch right through it. And I have had races where I haven't hit that wall. And that's due to a whole lot of training and preparation. And it's entirely possible that you could be that rare practice that doesn't hit the messy middle. But be prepared for it. Be prepared for the fact that you're likely to hit the messy middle. Let your team members know. Arm them with information. Arm them with training. Make sure they've listened to past episodes of the Less Insurance Dependence podcast so they know what to say. They know how to say it. And they're prepared for it. And make a strategic decision about who's going to talk to patients based on personality style. So the D's and the I's, anybody can talk to those patients because all they're going to want to know is, can I come to your office? Can I use my benefits there? And will you still file my insurance? So anybody can talk to those patients. The S's, it'd be wise to assign the person in your practice that has the best connection to that patient. Could be their hygienist, could be the doctor, could be an assistant, could be an admin team member. Who's most, let's say the patient's name is Linda, who's most connected to Linda? And that person will be most successful with the S, because these are really relationship people. And they're not going to want to disappoint you by going somewhere else. And the C's should be the person in your office that has the most insurance information, because it may take all that information. Now, one more point, and this is something that I want you to be prepared for. There will be a number of patients that choose to leave your practice and they go somewhere else. And they don't have the kind of experience that they've had in your practice somewhere else, and they bounce back. They come back to your practice. We playfully call those patients boomerang patients, like the Australian boomerang. It goes out and it comes back. Well, that's what happened will happen with a number of these patients that leave. And they might say to you, I really like it here, but budget's really tight. I think I'm going to, have to go to a doctor who is in network with my insurance. And if they say that, there's a point at which you've done everything you can. The best thing to do at that point is to say, Linda, we understand. We are family people. And we understand budgets. Please know that we're going to miss you. And also know that if you don't experience the kind of care that you've come to be accustomed to in our practice, please know you would always be welcomed back. And so we kick the door wide open for them to come back. And so share that with your team members and have some team meeting around that where we talk about these boomerang patients, and letting them know that we would be always welcome back with open arms. And you'll be surprised. The number of patients that leave and come back is usually a fairly significant number. So interesting to see that occur as well.